Thank you for viewing this film produced by the Department of Urology at the Royal Bournemouth Hospital. This film is about prostate cancer. There are a number of different treatment options for prostate cancer. Not all patients are suitable for all the treatment options, but for many patients there may be a choice between 2 or 3 different approaches. The consultant urological surgeon looking after you and other members of the team will have discussed with you which options you should be considering for the treatment of your prostate cancer. It's important to recognise that there is rarely a single right answer for the treatment of prostate cancer. The different treatment options have different advantages and disadvantages. The team looking after you will explain these aspects of each treatment option and will help you decide which treatment best suits you. It's likely that you will also want to discuss this decision with members of your family and with your GP. In most cases, there is no urgency to decide which option you want to have. This film is intended to supplement the written and verbal information that you will have received, and it's not intended to cover comprehensively all of the issues that you will need to consider. This film is about surgical removal of the whole of the prostate gland, an operation known as radical prostatectomy. Radical prostatectomy is one of the treatment options for men who have localised prostate cancer. That is, prostate cancer confined to the prostate gland. One of the key advantages of a radical prostatectomy is that we're able to give the whole prostate gland to the pathologist. This means that we get the most accurate opinion about exactly what's going on in the prostate, and this means we can give the patient more accurate information about what their future prognosis might be. Interpretation of test results after a radical prostatectomy is often more straightforward than it is after other treatments for prostate cancer. In particular, the PSA prostate blood test, the prostate-specific antigen test, is easier to interpret after a radical prostatectomy compared to other treatments. When deciding which option to go for prostate cancer, a number of other things get taken into account. Not all options are suitable for all men, but surgery is often a good option if a man has coexistent urinary or waterworks symptoms, and it's possible that surgery in that situation can treat both the prostate cancer and the urinary symptoms that the man's complaining of. Another advantage of surgery is the option that there is for additional treatment after the operation if the operation doesn't cure the prostate cancer. We would only ever embark on the operation in the hope and expectation that surgery might cure the patient from the disease. Sadly, that's not always the case, and if there is evidence after an operation that the operation hasn't cured the disease, then after surgery there's the option for additional treatments, such as radiotherapy. The reverse isn't true. If the patient chooses radiotherapy first, it's not then possible to go ahead and offer surgery should the radiotherapy turn out not to have cured the disease. In the Royal Bournemouth Hospital now, the majority of patients who have an operation for prostate cancer would have it done by keyhole or laparoscopic surgery. One of the advantages of this approach is that the recovery is quicker in comparison to the traditional way of doing the operation via open surgery via a cut. So for most patients, they would be in hospital no more than a couple of nights after their operation, and for most patients they would be virtually completely back to normal by about 6 weeks after their operation. And this is a faster recovery than we used to see when the operation was mainly done through open surgery. It's important to remember that radical prostatectomy is a major operation, and like all major operations, there are risks. These risks will be common to all major surgery, things like bleeding, infection, damage to other structures, and if these things do occur, then it's inevitable that the patient's recovery will be delayed to a degree. All treatments for prostate cancer can affect a man's ability to achieve and sustain an erection. The risk of this happening does depend on a number of other factors, such as a man's age, other health problems, medicines he's taking, and what his erections are like before the treatment. It's probably true that the risk to erections is more immediate after a radical prostatectomy than it is after some of the other treatments for prostate cancer, although all prostate cancer treatments can affect erections to some degree. In many men, erections may be affected after the operation, but it's often the case that erections will gradually recover. The timescale of this is uncertain, and there is a group of men in whom the erections will never recover to be as good as they were prior to surgery. Urinary continence can also be affected by a radical prostatectomy. This means that a man's ability to hold on to his urine can be reduced. This is often noticeable when coughing, laughing, sneezing or changing position, and under these circumstances a man may leak a bit of urine when he doesn't want to. This means in the early post-op period men may need to wear some pads in their underwear to prevent this being a major problem. Although urinary incontinence is quite common after a radical prostatectomy in the early post-op period, in the vast majority of men it recovers completely. There is, however, a small group of men where urinary continence can be permanently affected after an operation. A week or two before your operation, you will have an appointment for a pre-clerking visit with a nurse or doctor from the urology team. At this visit, your fitness for surgery will be confirmed, some blood tests will be taken, and the operation will be discussed with you in detail, and then you will be asked to sign a consent form. On the day of your operation itself, you will be admitted to the Sanborn Admissions Unit. There you will meet the surgeons and anaesthetist involved in your operation, and there will be a further opportunity to ask questions about anything that remains unclear. In a laparoscopic prostatectomy, 5 ports or tubes are placed into the abdomen through 5 separate small incisions. Using these ports, a camera and fine instruments are inserted into the abdomen, and the operation is performed simultaneously by 2 surgeons who operate together by looking at a video screen. When the prostate gland is removed, the bladder is joined back onto the urethra, the water pipe. This join is called the anastomosis. It takes some time for the anastomosis to heal. For this reason, a catheter tube, plastic urine drainage tube, is inserted into the bladder at the time of the operation. This catheter is left in place for 1 to 2 weeks. Patients are discharged home with the catheter in place and are brought back to the hospital for a morning or afternoon when the catheter is removed. It's quite straightforward to look after the catheter and drainage bag at home, and the nursing staff on the ward will make sure that you are confident with this before discharge. A separate plastic tube drain is usually also placed at the time of the operation. This typically remains in place for 1 to 2 days and is usually removed before leaving hospital. Before you leave hospital, you will also be taught how to give yourself an injection with a tiny needle on a daily basis. These injections help to reduce the risk of blood clots or thrombosis. It's important to remember that no 2 men's experience is the same, and recovery after surgery varies between individuals.
I was diagnosed in the first place through, of all things, a spider bite. I got bitten on the arm and my arm swelled up quite bad. And I went up to see my doctor, and the spider bite wasn't a problem as such. I got some antibiotics and cleared that up. And he said it's quite some time, I think it was about 5 or 6 years since I've been to see my doctor. And he said, we'll run some blood tests while you're here. And one of them was a PSA test, which came back quite high for my age. And I really didn't have any symptoms or problems. And I think that was quite a big shock. I reacted to the news of a high PSA level. It really hit home hard because of the cancer, prostate cancer being quite rife within my family. The most difficult thing I find was actually going to the hospital and being told the results of the biopsy, and also being told I had cancer, and the fear that it could have spread. I was quite surprised with the support that I got, because not really having a lot to do with hospitals and doctors and whatever, and I was quite impressed, even going to the hospital, how well things were organised and everything just followed on from one thing to the other, and it took a lot of the stress out of it. The things that surprised me most about the recovery, the short stay in hospital. I think it was about 4 nights, 3 to 4 nights, something like that. And also how well I felt after the operation. When I left hospital, I was fitted with a catheter for 2 weeks. And after the catheter was removed, it was a further 3 weeks before the bladder started to settle down. I went back to work, it was around 8 weeks. We're 3 surgeons, and the work is quite heavy, so I had to be just a bit careful. I also do Ki Aikido, and I practice that twice a week, and it's 2-hour sessions, and I was fully back into the training for that after, I think it was about 5 months. Since the operation, I've felt really good and relieved to have everything out of the way, and all the PSA tests are really 0, so I can't ask for anything more. If someone asks me any questions about the problems and whatever with prostate cancer, I think what I would do is say to them, don't be frightened to ask questions. I found the consultants really honest and open, and I think that really helped me in choosing, my treatment. The other thing, when I went for the results of my biopsy, I went alone, and I really think there's a lot to take in, and I think really you should have someone with you.
If you would like any further information about anything we've covered in this video, then please speak to the cancer nurse specialist whose details you will have been given when you attended the outpatient clinic.